Welcome to Evergreen Family Medicine. Today we're talking with Rachel Nielsen. She is an ultrasound sonographer with Evergreen Women's Health. And we're going to learn about ultrasounds and information about when is the right time and what are they looking for. All kinds of things to learn from you, Rachel, especially since it's been about 19 years since I've seen an ultrasound. So I have a lot to learn. So first of all, tell us about your background a little bit and how long have you been with Evergreen?
So I've been with Evergreen since October. And then I've been with Roseburg Women's Healthcare, which is who we were previously associated with, since 2007. So I got hired by Dr. Hollander back in 2007, and previously I worked at a couple different maternal field medicine offices for different providers.
So you've been doing this a long time.
Since 2005.
What's so great about your job?
I love the specialty of mainly OB. And I feel like it was a niche that I found and I really enjoyed it. And so getting that opportunity to come to Roseburg where we had grew up, me and my husband, it was such an awesome opportunity to work with Dr. Hollander and then married Dr. Mary Powell. And so it's been a good opportunity since then.
Yeah, you're working with an amazing team of people now, and it feels like there's just a lot of discussion around the team itself, the talent that has been assembled at Evergreen Women's Health, and the way that Evergreen wraps around the patients at Evergreen Women's Health as well. People keep talking about how unique it is. What's your perspective on that?
I think we're unique because we have providers that we really enjoy working with. I feel so blessed that all of the providers that I've ever worked with since I came to Roseburg, and actually since my entire career of doing sonography, providers that treat you like an equal. So obviously there's a difference in occupation, and same with working with anybody there. It's just been a really good experience, and I feel extremely blessed of how our office works together.
So let's tell people a little bit about ultrasounds, and other than starting at the beginning, I guess I don't know where to start. So when would be the right time for somebody to come and have their first ultrasound?
Okay, so for obstetrics, we like to scan patients around 8 weeks. So typically patients will call right after they find out they're pregnant, between 4 and 5 weeks, and we like to schedule them around 8 weeks. And that way we just know that there is going to be a fetus if there's a good pregnancy. I mean, we do scan patients earlier. Typically, we don't see a fetal pole or a fetus until about 6 weeks, so that's the absolute earliest we like to. But it's nice to scan patients around 8 weeks. That's called their dating ultrasound. The earlier the ultrasound, the more accurate of a due date. And so that's kind of what we base it around. And then we like to do the anatomy ultrasound around 20 weeks. And that's probably the one you remember from when you had your children. That's the ultrasound where I take a look at the anatomy, make sure everything looks structurally normal. We also do some measurements, and then we can give the baby, we know how much the baby weighs. And then, of course, if people want to know the gender, that's when they can find out the gender.
How much has the technology changed since you've started, and maybe even in the last few years?
Quite a bit. When I first started, I worked at a maternal fetal medicine down in Honolulu, and one of the physicians was a huge proponent for 3D ultrasound. Just absolutely loved it. So we had GE machines that did 3D, but it definitely has changed over the years. I feel like we do see a little bit more detail. We use 3D ultrasound mainly just to get images of like what your baby looks like, even though I wouldn't say it's completely accurate, but we can see the face. Sometimes 3D does actually have a diagnostic purpose for ultrasound, but mainly we use it for like fun and entertainment.
And Rachel, we've talked about Evergreen Women's Health. The new twist to all of this, from what I understand, is that ultrasounds can take place now right there at Evergreen Women's Health. You don't have to go someplace to have an ultrasound. Is that right?
Yes, that is very true. So luckily with our practice, we do have an ultrasound machine in office, and I work solely for Evergreen Women's. And so we are able to do OB and GYN ultrasounds in office rather than having to outsource them to another facility. So I think that makes it nice for the patients. They can have an ultrasound done and then also see a provider afterwards if needed. So I think that is a huge plus for our patients.
And when it comes to ultrasound, there are other types of ultrasound than just looking at the baby in utero. Tell us what other reasons or other ways ultrasound is used.
So we also specialize in ultrasounds called gynecologic or pelvic ultrasound, which is for gynecological non-pregnant women. So I can look at the uterus, ovaries, and adnexas. Adnexas are just the areas on the sides of your pelvis. And so if a woman has had a hysterectomy, we can still look at ovaries, and we always like to take a look in the whole pelvis area just to make sure there could be any sort of reasons why a doctor would order one. So of course the provider would order an ultrasound, and then that's where I come in.
All right. And it can happen right there at Evergreen Women's Health?
It does, yep. Usually we just order it right then and get them on the schedule.
Well, one of the favorite things for a new parent is to show the ultrasound pictures to their friends or put them on Facebook and all of that. I understand there's a new way for that information to be shared to the patient.
Yes. So besides images that we print out, so everybody always gets the images that we print out that they're used to, we now have a new reporting system, and it's called Trice. And so I'm actually able to send images to the patients electronically. So they just receive a text message, they click on the link, and they can download all of the pictures that I've just printed out. So that's fun for them, because now instead of having to take a picture of their picture, they can actually just export the photo themselves and send it or post it or whatever they'd like to do with it.
First baby pics.
Yeah.
Wonderful. Well, Rachel, thank you very much for stopping by.
Thank you.
Rachel Nielsen is an ultrasound sonographer with Evergreen Women's Health. You can learn more about everything happening at Evergreen Women's Health and at Evergreen Family Medicine online at evergreenfamilymedicine.com. And you can follow us on Facebook, Twitter, Instagram, and YouTube.